Alzheimer's disease is a name you hear a lot, and most of us know the meaning of it, which is the loss of memory. However, what is the mechanism of the onset of this disease? Where does it occur? Why does it even occur? And is it a problem of huge importance? As a matter of fact, it is important since 1 of 10 people above the age of 65 has Alzheimer's, with a total of 44 million patients worldwide. Of these patients, 3% are between the ages of 65 to 74, and 19% between the ages of 75 to 84, and 47% for 85 years or more. Moreover, Alzheimer's is the 6th leading cause of death. Before discussing Alzheimer's, I'm going to briefly explain the meaning of dementia. Dementia is defined as the development of memory impairment and other cognitive deficits as inability to write, learn, and make decisions. Even though these complications occur, the patient still presents with normal level of consciousness. Dementia is a vast group of diseases like infections, vascular and traumatic diseases, as well as metabolic and nutritional diseases. And the part of our main concern are neurodegenerative disorders. And as the name implies, it means that there will be loss and degeneration of neurons. Neurodegenerative disorders are many, and they include frontotemporal degeneration, Parkinson's disease, palsy, and the subject that I'm going to tackle in this video, which is Alzheimer's. Alzheimer's is the commonest cause of dementia. The brain is an extremely complex organ of our body, with most of its details still not well understood. However, in order to discuss Alzheimer's, I'm going to take a part of the brain as shown here in a coronal plane. As you can see, the brain consists of gray matter, white matter, and lateral ventricles, which are responsible for the production of the cerebrospinal fluid. These lateral ventricles are also surrounded by some gray matter. Alzheimer's occur in the cortex of the gray matter. Now, what's the pathology behind this disease? Alzheimer's is divided into two types. The first one is sporadic and often called late onset, meaning that it takes time to occur and progresses with age, while the second one is familial, which is less common and occurs at an early onset. In normal physiology, there is a transmembrane protein found in cells called amyloid precursor protein, or APP. Normally, this protein can be cleaved at 3 sites, as identified in the drawing by 1, 2, and 3. 1 is cleaved by beta secretase, while 2 is cleaved by alpha secretase, and 3 is cleaved by gamma secretase. Normally, if alpha and gamma cleaves this protein, that results in the formation of a soluble fragment that has no complications. However, in the sporadic type of Alzheimer's, if this protein is cleaved by beta and gamma, it results in the formation of A-beta peptide, which is insoluble. A-beta peptide may aggregate and accumulate in the brain tissue between neurons, which result in 2 complications. The first one is that these neurons will no longer have the ability to relay with each other. Therefore, there will be loss of brain functions. The second complication is that these aggregates of A-beta peptide can induce inflammation, which accumulate neutrophils, macrophages, and other inflammatory cells. The APP protein is normally turned over by the body with time. Therefore, the A-beta peptide will accumulate over time, and at a certain age, the patient will start complaining of symptoms. Problems in the APP and gamma secretase have been linked with the alleles of A-lipoprotein E4, which increases the risk of Alzheimer's by accelerating the deposition of A-beta peptide, while the ApoE2 or apolipoprotein E2 actually decreases the risk. Another gene involved is SORL1, which also increases the deposition of A-beta peptide. On the other hand, the familial type occurs at a younger age, in which there is an association with mutations in presenilin 1 on chromosome 14 and presenilin 2 on chromosome 1. The familial type is also associated with trisomy 21, also known as Down syndrome, since APP is actually located on chromosome 21, and a patient with Down syndrome has 3 copies of chromosome 21 instead of 2. So one extra chromosome 21 leads to an increased chance of A-beta peptide deposition. Now, what is the morphology of a patient with Alzheimer's? Macroscopically or grossly, the normal brain consists of sulci and gyri. So the patient will present with cortical atrophy, meaning there will be gyri narrowing and sulci widening. This leads to compensatory ventricular enlargement. On the microscopic level, after performing brain biopsy, which is taking a small amount of tissue from the brain and is extremely difficult, the patient tissue will have neurotic plaques, which are focal spherical collections of neurotic processes around central amyloid, which is A-beta amyloid. These are diffuse and found in the cerebral cortex and basal ganglia. They can be found around blood vessels, causing hemorrhage. There will also be neurofibrillary tangles, which are found inside the cell, caused by hyperphosphorylation of a protein called tau that is found in microtubules. These microtubules are responsible for cell shape, so a problem in this protein tau leads to impairment of the cell structure, leading to formation of tangles. Complications of this disease start with alterations in mood and behavior. They then progress to memory loss and disorientation, then aphasia, in which the patient has difficulty in speaking. Later on, the patient will be disabled, mute, and mobile. And in severe cases, death can occur due to intercurrent pneumonia and infections. Diagnosis of patients with Alzheimer's is a combination between pathology assessment and clinical presentation, after excluding all other types of dementia. So the diagnosis is by exclusion. Therefore, the diagnosis is difficult to reach. So the doctor will do physical examinations such as reflexes, muscle tone, and balance. They will also do mental status tests that put their brain under the test. They can do MRI and CT scan of the brain. And they can do tau and amyloid imaging, which is difficult to perform. As for the treatment of Alzheimer's, it is still under investigation with no definitive cure. However, there are some drugs that help with the symptoms to relieve them. These drugs include, first of all, there are cholinesterase inhibitors like donepezil and galantamine. They work by boosting cell-to-cell communication, which is missing in Alzheimer's due to A-beta deposition as previously discussed. The side effects of cholinesterase inhibitors are nausea and vomiting, loss of appetite, and cardiac problems. Another class of drugs are memantine, also known as Namenda, that also slow down the progression of this disease. That's all you need to know about Alzheimer's disease, the normal physiology, the pathology and its types, the complications, the diagnosis, and the treatment. Thank you for watching.